On your health tonight, America versus the measles. The nation's health secretary says the U.S. is doing better than other countries at preventing infections. But what does the data actually show?
So let's drill down. Joining us right now, Dr. John Brownstein, to help us drill through those numbers, Chief Innovation Officer at Boston Children. It's always great to see you, Doctor. So let's start with the numbers. Let's start with the national numbers. Right now, there have been nearly 1,800 confirmed cases in the first 4 months of this year. Compare that number to last year's record breaker. And as you look at these, what do you think that shows?
Well, I'm concerned. I mean, the rapid spread is concerning. Last year's total was about 2,300. We're already at about 78% of last year's record. So the pace is a warning sign. And we're not just seeing these one-off importations or isolated travel cases. We're seeing sustained transmission and outbreaks. And the key driver is what we call immunity gaps. Most communities that we're seeing with outbreaks are under-vaccinated. So the bottom line is this is a preventable disease that's gaining ground because MMR vaccination coverage has slipped below the level needed for communities to really protect themselves.
Well, now RFK Jr. says other countries are dealing with measles outbreaks that are much worse. Is that true?
Well, some countries do have larger outbreaks, and measles is clearly rising globally. But that doesn't mean the U.S. is doing well. Our trend is moving in the wrong direction. And raw case counts by country can be misleading. You have to adjust for population size, healthcare access, vaccination status, and transmission. So it's a false comparison. Outbreaks elsewhere should not be used to minimize the risk here. There's a real vulnerability in this country.
Doctor, I understand the scope of it, and maybe boiling down to one specific case might not be fair. But as you know, here in Massachusetts, the Department of Public Health issued an alert earlier this week about a passenger at Logan Airport possibly exposing other travelers to the measles. Now, we were told, and it's been told, that it happened in Terminal C, which is not the whole airport, it's just one of the terminals, and between 12 and 2:30 in the morning. So how would you describe the risk for anyone who may have been in the terminal if there were people there at the same time?
Well, there were people there, but if you're fully vaccinated with MMR, the risk is so low. If you have those 2 doses, that's 97% effective. So the risk is minimal. If you're unvaccinated, infant, pregnant, immunocompromised, that is when the risk is more concerning and you may want to really look for symptoms. Measles does not require direct contact. It spreads through the air and can linger for 2 hours after an infected person leaves a location. So what does that mean in Terminal C? During the exposure window, that's April 14th between midnight and about 2:30 a.m., check for vaccination status, monitor your symptoms through May 5th and make sure to call ahead before going to a clinic or ED because, of course, you don't want to expose other people.
All right, Dr. Brownstein, thank you so much for your insight.
Great advice. Great to see you, Doctor. Have a wonderful weekend.
You too. Thank you.
Let's take you out.